Good day, I am Laika Berin from BSN3C, and for today I will be discussing the Glasgow Coma Scale. The Glasgow Coma Scale, also known as GCS, is the most commonly used scoring system for describing the patient's level of consciousness after a traumatic brain injury. We use GCS to check the neurological function and level of consciousness. It is also used to check the changes of the patient to determine the proper intervention that the physician should do. The Glasgow Coma Scale or GCS is based on three patient responses. The first one is the eye opening, the second is the verbal response, and the third is the motor response. Scores will range from 3 to 15. 3 to 8 is considered as severe, 9 to 12 is moderate, and 13 to 15 is mild. And for the next part, I will discuss the three patient responses separately, starting from the eye opening. In eye opening, the best response that the patient could get is a score of 4. So when assessing the eye, the first thing that we need to look is if the eye is spontaneous, meaning if the eyeball is moving around or is it following around or looking around the room. When this happens, it means that the patient eye is spontaneous, so they can get a score of 4. Next, if the client's eye is closed, we need to use a verbal stimuli or we need to make a sound. We need to ask them some questions or just saying hi or hello. If they move their eye when we make a verbal stimuli, they will get a score of 3. Next is the painful stimuli. We can simply use our hand to touch the patient's arms, but if they don't wake up, we need to use a pen to give them a light pressure on their nail. If their eyes open to that, it means that they will get a score of 2. And lastly, if there is no response at all, they will get a score of 1, which is the lowest score. Let's move on to the verbal response. The first thing that we need to do is to ask the patient's name or their birthday. If they respond correctly, it means that they are oriented and they will get a score of 5, which is the best response. But if they answer the questions incorrectly, it means that they were confused and will have a score of 4. Next, if they were using inappropriate words, then they will get a score of 3. For example, when we ask their name or birth date and the patient answer is orange, it means that it doesn't make any sense and considered as an inappropriate word. And if they are using incomprehensible sound, for example, we ask about their name and they're just giving us a grunt or moan, that would be considered as incomprehensible sound. And they will get a score of 2. And if they are giving no response at all, it means that they will get a score of 1, which is the lowest score. In motor response, the best response that the patient could get is a score of 6. So for the motor response, we will give the client some commands and see how they will respond. They will get a score of 6 if they can follow commands correctly, such as making a fist or sticking their tongue out or showing their wristband. Next, if we put an IV and they recognize the pain as well as they make a movement across their body to stop that pain, it means that they will get a score of 5 because they localize the pain and make a movement across their body to remove that pain. But if they are just withdrawing the pain, for example, we put an IV and they were just withdraw or pull their arm but not making a movement across their body to stop that pain, it means that they will just get a score of 4 because they only withdraw the pain. Next is abnormal flexion. It happens when the patient is making a movement using his both arms and legs and he's pulling everything in, which is called decorticate. And by that, they will get a score of 3. But when the patient is just laying and extending their body without moving their limbs, it is called decerebrate because they only have abnormal extension without making a movement and they will get a score of 2. And lastly, if they have no movement at all, they will get a score of 1, which is the lowest. As you can see, those numbers are the scores that we will give to our patient when assessing their level of consciousness. We will get the GCS score when we add the result of those 3 areas of the body that we need to assess together. The score has a range from 3 to 15. The higher the number, the better. Because if we got a score less than 8, it usually indicates coma, which means that the patient can't breathe on their own. So basically, we need to put a special tube to their mouth down to their airways so that we can connect them in a mechanical ventilator. Again, the higher the number, the better. And if the score is less than 8, it means that the patient is in trouble or in a complicated condition. That's the end of my discussion. Thank you for listening.